global healthcare in the 21st century. That's the mission of the World Health Summit. And I welcome you all to the World Health Summit 2019 here in Berlin. Bienvenue à tous, salam alaikum, seien Sie herzlich willkommen. Excellencies, presidents, ministers, state secretaries, all protocols observed. Dear colleagues, ladies and gentlemen, dear friends, and especially welcome to the young people. And may I ask, there are groups of young people. One is the Young Physician Leaders, there are the Global Young Academies, and many others. May I ask all those who are among the young people, either organized or for convenience below 40 years old, will you please stand up? So this is by far the majority. And I could say, please keep outstanding and make some exercise. It's healthy. My name is Detlev Ganten, and I greet you all here in Berlin at the World Health Summit, but also those who follow us on live stream around the world. We have one noble goal: to improve health worldwide. And we have one world, the wonderful, unique blue planet, our Earth. One health means that good health requires healthy nature, healthy animals and plants around us. Planetary health defines climate and environment as important determinants of human health. Both imply that we need a holistic view on health, which includes our biology, our environment, and our lifestyle and behavior. This holistic view will at the same time help us to overcome the barriers and walls of different silos, disciplines, attitudes, politics, ideologies. This year, gentlemen and ladies, we are celebrating the 250th birthday of a very famous scientist who traveled around the world and described and measured every detail of the nature he observed. In his celebrated Cosmos book, he tried nothing less but developing such a holistic view on nature. This great scientist was Alexander von Humboldt. He's even more important now than he was 250 years ago. And we shall hear more of him later this evening. Ladies and gentlemen, enormous progress has been made in many aspects. People live longer and healthier in most parts of the world. But this progress comes with a price: the exploitation of resources, destruction of nature, unhealthy urbanization and lifestyles, toxic footprint and heating of the cosmos. It is time to act and to take responsibility, all of us, in good partnership. The 17 Sustainable Development Goals provide this holistic framework. Healthy lifestyles reduce toxic footprints, and at the same time, they provide immediate co-benefits regarding climate, regarding mobility, regarding nutrition, and some other of the Sustainable Development Goals. Partnerships for the goals, the Sustainable Development Goals, number 17, is already been strengthened by all of you who registered and who participate in the World Health Summit 2019. Thank you and welcome. In a fantastic partnership, we have created this wonderful academic network of the M8 Alliance, and we always have an international president. This year's president is Professor Ali Jafarian from Tehran University of Medical Sciences. He is a surgeon, transplantation specialist. And Ali, may you take up the floor here and give us your greeting remarks. Thank you very much.
In the name of God, the compassionate, the merciful, honorable ministers, heads of global organizations, dear peers, friends and colleagues from global health community, distinguished participants, ladies and gentlemen, good afternoon and welcome to the 11th World Health Summit annual meeting in historical and beautiful Berlin. As Detlev said, science has to take responsibility to reach optimal health, which is in turn an essential human need and right. The complexity of modern life and globalization creates loads of unhealthy events and necessitates us, as global health advocates, to do our utmost effort to produce, disseminate, and implement what is good for people's health worldwide. This is exactly why we are here today. With cutting-edge science and technology at our disposal to address multidimensional and difficult challenges of global health, we need solidarity and compassion now more than ever. Exchanging ideas and learning from each other is the most effective way to make our greatest hope for a better world a reality we expect in the future. We need to keep communicating with each other and remain united for global health. As International President of WHS 2019, I have personally experienced the great potential of the World Health Summit to translate knowledge into better health and the true meaning of working together. The very successful 7th WHS regional meeting in Kish Island, Islamic Republic of Iran, that hosted over 750 participants, including 100 world-class scholars from 47 countries, at the time of the toughest unilateral sanctions against an ancient and peaceful nation, was precisely a clear sign of World Health Summit's vision in prioritizing humanity and health over political considerations and unreal boundaries. This is the beginning of a long way, of course, that we have to follow, applying beneficial knowledge in an equitable and affordable way anywhere in our planet. Let me finish up by wishing all of you 3 days of constructive and stimulating dialogue, exchange and learning, and beginning new collaborations, all towards greater unity for global health. Thank you.
Thank you, Ali. Now it's my great personal, and if I may say so, presidential pleasure to welcome Minister Jens Spahn. Minister Jens Spahn, Minister for Health in Germany, is a minister of superlatives. He is the youngest member in the German cabinet. He is the most active, if I may say so. He has, within a relatively short time, produced most of the innovations and laws in the health system in Germany. He has been a long-standing member of the Health Committee of Parliament, and also, and importantly for today, he's a very strong supporter of global health. And please welcome with me Professor, not professor yet, Minister Jens Spahn. And I may say so, you have a long career before you, and you may be even advanced to other important positions.
Later. Professor Ganten, Professor Ali Jafarian, Excellencies, distinguished ladies and gentlemen. Once again, it's an impressive view and an impressive perspective to see you all from here, from all over the world, having come here to Berlin, once again for the World Health Summit. And every year, the World Health Summit gives us the opportunity to pause for a second and review what we have achieved. Where do we stand right now? Polio has almost been eradicated. HIV/AIDS have been driven back, and we have managed to cut overall infant mortality worldwide by half. These are positive developments, but one question remains. Is this where we want to be? My answer is no. The world's health status is not satisfactory. Let me give you examples. NCDs, non-communicable diseases such as cancer, diabetes, and heart disease are globally on the rise. Almost 15 million premature deaths every year, not only in low-income and middle-income countries, but also in high-income countries. As for pandemic preparedness, we all know that the world will face another pandemic. The only thing we don't know is when it will happen and how severe it will be. Is the world well prepared for this? If we look at the robustness of health systems worldwide and the implementation of the international health regulations, core capacities, we have to confess, no, the world is certainly not adequately prepared yet. Today, more than 1.6 billion people live in areas where protracted crisis and weak healthcare systems leave them without access to basic healthcare. And I could go on and on and on with a list of pressing health challenges. Indeed, it is true, we have agreed to address them with the Agenda 2030. However, we are far from reaching the health-related SDGs and will fall even further behind if we carry on with business as usual. We have 10 years in which to fulfill our ambitious agenda. So we have to intensify our efforts, embrace true commitment for global health, and work in partnership across all sectors and stakeholder groups. Ladies and gentlemen, it is a great honor for me to open this year's World Health Summit. The summit brings together all the relevant actors who contribute to SDG 3. Politicians, scientists, think tanks, representatives of the private sector, and civil society from all over the world. It is our strong belief that global challenges can only be addressed jointly. Last month, the UN high-level meeting on universal health coverage in New York saw the launch of the Global Action Plan for Healthy Lives and Well-being for All. Having participated in the event myself, it was an impressive political signal to see 12 global organizations commit to streamlining their contributions into a structured process to attain the health-related SDGs. This clearly shows that when the vision is clear and the expectations are high, we can overcome our vanity, we can overcome competition for resources, and we can overcome our way of doing business as usual and find new solutions. I would like to extend my gratitude to the 12 organizations and WHO for its leadership in this process. The launch of the Global Action Plan was just the starting point. Now, implementation at country level is key. Milestones have to be defined, and all agencies have to stick to their commitments and work hand in hand. Let's make sure in 2023 the review shows we are on track. Ladies and gentlemen, the SDG 3 Action Plan initiative is a clear political statement that Germany truly believes in constructive multilateralism. More than other countries, Germany has profited from a relatively stable, rules-based international order over the past 70 years. For us, living in peace, economic prosperity, and an open society is directly linked to rules-based multilateral cooperation. All key global health challenges call for multilateral action based on partnership and often grounded in a regulatory framework. Thus, it is a key priority for overall German policy, including our global health policy, to contribute to the preservation of this order, to further develop it in partnership with others, and to promote multilateral cooperation. It is in this context that we see our commitment and leadership in fora like the G7 and the G20, within the European Union and the United Nations. And Germany has also shown strong commitment for organizations like Global Fund, which will be receiving 1 billion euros in support over the next 3 years from the Ministry for Economic Cooperation and Development. Our understanding of constructive multilateralism in global health also explains our strong commitment to the relevant international organizations, in particular to the World Health Organization, and our full support for it, politically, financially, technically, and through our involvement in its governing bodies, so as to gain a better understanding of the progress of WHO's emergency reform, as well as more general overview of the broader health challenges facing Africa. I visited 4 African countries 3 weeks ago. This was, for me, once again, a very impressive experience. It goes without saying that I needed to see for myself effects of the current Ebola outbreak in the Democratic Republic of Congo, show our support to the communities affected, and learn how we, the international community, can better support the response to health emergencies. As a result of this visit, I committed an additional financial contribution to WHO's contingency fund of Germany, and Germany has also committed to support the African CDC, which I have visited in Addis Ababa, and it's very impressive to see what the African Union is about to do in this regard. What I have also seen is that Ebola is only the tip of the iceberg. Most people are dying from easily treatable and avoidable diseases, such as measles or malaria. Even simple interventions, such as immunization, still remain a huge challenge for weak and under-financed healthcare system. Of course, every country would still need to allocate adequate resources to its own healthcare system. Ladies and gentlemen, good global health starts at home. As a health minister, I have homework to do as well. In Germany, we have the potential to increase our immunization rates. That is why I have submitted a draft law on protection against measles and strengthening immunization. The draft law obliges all children entering school or kindergarten to be vaccinated against the disease. It's, by the way, the first obligatory vaccination we introduced in Germany for 150 years. An area that is close to my heart is harnessing the digital revolution. It will make sure that the electronic patient record will be available to the German population by 2021. Everyone will be able to access their personal medical data and make it available to their doctors. In addition, telemedicine and artificial intelligence will contribute to further improving health in underserved regions. And once again, the visit to Africa was very impressive in this regard. In Abuja, Kigali, and Addis Ababa, I had the opportunity to discuss with young entrepreneurs, young, smart entrepreneurs who really wanted to make a difference for their health systems by treating the untreated through mobile health. I've seen the idea of a hybrid drone bringing vaccinations to remote areas and many, many other good ideas. And I had the impression every now and then we might to see this other part of the development in Africa too. Yes, there are problems, but there are very good and innovative ideas as well. And to see that is important too, and to support that too, by the way. Prior to this, the core ethical issues is how to make the best use of the potential of big data and AI for the individual and common good, while ensuring both self-determination and solidarity, the right to privacy and the enhancement of individual responsibility and patients' capacities. So governance is needed, international governance. We thus support the call for international cooperation and coherence. Both are necessary if we want to achieve a value-based digital health ecosystem. So in the second half of 2020, Germany will take over the EU presidency for 6 months. The main focus of our presidency in health will be digitalization, big data, and AI within the healthcare systems. Moreover, together with our trio partners, Portugal and Slovenia, we want to make the European voice in global health heard. The role of the EU in international fora, such as the World Health Organization, must be increased. We are fortunate that next year's World Health Summit will take place during the German EU presidency. This will be the perfect opportunity to discuss global health issues together with our trio presidency partners, as well as other European and international partners and friends. So I'm very much looking forward to see you all again next year during our presidency. But first of all, I wish you an interesting and impressive, a good week here in Berlin. Feel welcome to Berlin and Germany.
Ladies and gentlemen, I'm sure you realize I did not overstate that we have an ambitious Minister of Health with a great future, hopefully. And as a German, I may say, I'm really proud that Germany, with its history and also its potential in science, economy, and many other things, we really take global health to the heart. And as I can tell you, and we feel, this is across parties in Germany. This is the national consensus. That is something where we have to do more work. We have to take responsibility, and we have to deliver to the world, and also enhance and foster and motivate and culture multilateral interactions, partnership, as demanded in SDG 17, but as demanded also by common sense, if we look at the world at its present state. Thank you so much. Dear friends, we are moving from highlight to highlight in this special opening session, and this is a very special moment. I am going to introduce the Sing Academy, the Singing Academy, which many people, even in Germany, don't know. It was founded a long time ago, in 1791, and it was the first choir, mixed choir, where male and female could sing together, sacred and popular songs. This was unusual in that time. I mentioned already that we are celebrating Alexander von Humboldt. He traveled the world. He loved Paris more than Berlin. But then, in order to get him back to Berlin, they made him president of a very famous German association of doctors and scientists, Deutsche Gesellschaft für Naturforscher und Ärzte. And in order to make it attractive and to invite all the world of science, Felix Mendelssohn Bartholdy, one of the famous composers, was composing a very special song, the Welcome Cantate, which is called the Humboldt Welcome Cantate. And this Welcome Cantate is now going to be brought to you by the Sing Academy under the leadership of Friederike Stamer. And please welcome Friederike Stamer, the Sing Academy, and the Welcome Cantate for the World Health Summit 2019. With this welcome song, the world of science celebrated Alexander von Humboldt in 1828, and the song really indicates, it's in German, I'm sure you didn't understand everything. The spirit of friendship provides you with the energy to do what needs to be done. Couldn't that be a better motivation for what we are doing today? Now, this also was the introduction of the next speaker, Andrea Wulf. And Andrea is the celebrated author of one of the most successful biographies of Alexander von Humboldt, translated into any language Alexander von Humboldt was speaking. He was speaking about 10 languages fluently, and it's translated into all those languages which are spoken in the countries where Alexander von Humboldt traveled around the world. And Andrea was born in one country which Alexander von Humboldt never traveled to. He always wanted to go to India, but Andrea was born in India, in Delhi, and then she committed herself into a research into Alexander von Humboldt's life and created this wonderful biography. And she is telling us today what Humboldt means today and possibly inspires us for what needs to be done in the future in the spirit of Alexander von Humboldt. Andrea.
Hello, I have the honor to tell you in 10 minutes briefly about Alexander von Humboldt, whose life was packed with adventures, with discoveries, revelations, so this is going to be a bit of a challenge, so let me just start with a few facts. He was born in 1769, the same year as Napoleon. He was the son of a wealthy Prussian aristocratic family here in Berlin, but he left his life of privilege and he went on a 5-year exploration of Latin America. And it was a journey that shaped his life and his thinking and that made him famous across the world. He was adventurous, he was a visionary, he was relentlessly curious, and he was so restless that he said he felt as if he was chased by 10,000 pigs. And it was a restlessness that stayed with him all his life. He was the most famous man after Napoleon. His contemporaries called him also the Shakespeare of the sciences. He influenced scientists and thinkers, but he also influenced poets, artists, politicians, and revolutionaries. Thomas Jefferson called him one of the greatest ornaments of the age. Napoleon was jealous of him. Charles Darwin said he would have never boarded the Beagle without Alexander von Humboldt. Simón Bolívar, the man who liberated the Spanish colonies, called him the discoverer of the New World. And Goethe, Germany's greatest poet, declared a few days in Humboldt's company was as having lived several years. So why should we still care about him? I think there are many reasons. One is that he came up with a concept of nature that still very much shapes our thinking today. He came up with this idea that nature is a web of life. He described Earth as a living organism. He also united the arts and the sciences and said again and again that we needed to use our emotions and our imagination to understand nature. He was a pioneering map maker and is really the founder of what we call today infographics, because he used complex scientific data and expressed it in a very graphic, visual way. He's the forgotten father of environmentalism. He warned about the devastating effects caused by irrigation, deforestation, and monoculture, and amazingly, he predicted harmful human-induced climate change already in the year 1800. So he was a pretty extraordinary human being. But maybe more important than any of his individual discoveries is his holistic approach to the natural world and to knowledge in general. He was a true system thinker. He understood that everything was connected, from the smallest insect to the tallest tree, from colonialism to the devastation of the environment. Today we know that health issues and climate crisis, climate change, are tightly connected, from food shortages to diseases, from air pollution to obesity rates, from microplastics found in oceans and in humans. But it was Alexander von Humboldt who said, everything is interaction and reciprocal. And that's why I thought I'd tell you a little bit how he came to understand this connection between humans and the destruction of nature. As he traveled through South America, Alexander von Humboldt saw how humans destroyed nature. He saw this in particular at Lake Valencia, which is in the northern part of what's today Venezuela. It was a very wealthy agricultural region then. And he saw how plantation owners had destroyed the forest to make way for their crops. Seeing this destruction, he was the first to describe the fundamental functions of the forest for the ecosystem. So he talked about the trees' ability to store water, their ability to enrich the atmosphere with moisture, and their protection against soil erosion. It was at Lake Valencia that he said, that he talked about mankind's mischief which disturbs nature's order. And he saw this all over Latin America. At the high plateau of Mexico City, he saw how the local irrigation system, for example, had left the valleys below barren. And he wrote in his diary, I think that humans are raping nature. And he used the word raping. So he was pretty clear about his criticism. Later, in 1832, after a voyage through Russia, he listed the 3 ways in which humans were affecting the climate, and he wrote this. He said they do this through the destruction of the forest, through the distribution of water, i.e. irrigation, and through the production of great masses of steam and gas at the industrial center. So pretty prophetic, I think. Another great achievement of Alexander von Humboldt was that he democratized the sciences and that he fostered communication across disciplines. And one great example is the famous conference he organized here, the conference of the Association of German Naturalists and Physicians, which is the welcome cantata you just listened to. It was, so what happened in September 1828 was that 500 scientists from across Europe arrived here. So a little bit like what is happening here, only that you come from across the world. Humboldt called this conference an eruption of nomadic naturalists. And unlike other conferences where scientists were endlessly presenting papers about their own work, Humboldt put together a very different program. He didn't want scientists to be talked at. He wanted scientists to talk with each other. So he organized meals, concerts. He organized excursions. Some of the meetings were held amongst the botanical collections, the zoological collections. He put together small workshops across disciplines because he wanted to facilitate friendships and create networks. And at the opening ceremony, he said in his speech, without a diversity of opinion, the discovery of truth is impossible. He was also a scientist who, on the one hand, was obsessed with measurements. He carried 42 scientific instruments across Latin America, but he was not just interested in empirical data. He again and again said that nature must be experienced through feeling and imagination. He was really driven by a sense of wonder for nature. So his books combined, his scientific books combined evocative landscape descriptions with scientific observations. He didn't just see nature as a mechanical system, but as a world full of wonders that waited for him to be explored. And one of my favorite quotes from Humboldt is this, where he says, "What speaks to the soul escapes our measurements." So he was the most famous scientist in the world, but he returned from his voyage in Latin America, not just with measurements, but also with hundreds of drawings and maps and sketches. So for me, Humboldt is the connection between the arts and the sciences, between the Enlightenment and the Romantics. And we tend to draw a very sharp line today between the arts and the sciences, between the emotional and the rational. But I think Humboldt's insight that we should use our imagination and emotions remains maybe more than relevant than ever before. When I hear today's environmental debates, at least in the political arena, what I'm missing there is passion, emotion. No one dares to talk about the awe for nature. So we have scientists and politicians who tend to bombard us with numbers and with statistics, and I do know that I'm standing in a room full of scientists here and a few politicians. But what I'm missing is a passionate, dare I say, emotional advocacy for our planet. So I don't think that we can rescue our planet if we only talk about, for example, the atmospheric particles and air pollution, but we don't dare to talk about the unique, delicious smell of a forest after a sudden rain shower on a hot summer's day. Or if we only talk about the increasing acidity of our oceans, but we don't dare to talk about the beauty of wild waves. And I think we all know how bad oil production is for our planet. But it's not numbers and statistics and rational arguments. It's sometimes a photograph of an oil-drenched, black oil-drenched bird that makes us kind of stop. We all know how bad single-use plastic is for our environment, but it's the photograph of a beached whale with his stomach full of plastic that makes us stop. So more than 150 years ago, Alexander von Humboldt said that nature is in a mysterious communication with our inner feelings. And to me, it feels as if we have come full circle. And maybe this year, in 2019, when we're celebrating his 250th birthday, it's time to take a little bit of inspiration from him. Thank you.
Thank you so much, Andrea. Now I make a confession. When we were planning, of course, we have a big planning group and worldwide suggestions, and I insisted that 250 years Alexander von Humboldt, we need something on Alexander von Humboldt, and we need Andrea Wulf. And I had to persuade some people, those who have not read your biography, why Andrea Wulf and why Humboldt? And I think now it becomes clear. We can learn so much. It's modern science, of course, and it's the best of science which we need for global health, but we also have to look back sometimes what we can learn from the past. And we know that the progress we are having at the present time comes at a cost, as we know, by destroying nature, at least parts of nature. And you reminded us that we really have to think in this complexity and this interaction of everything in nature. Thank you so much. The next speaker is as important as all speakers are important. They all bring their own views. The World Health Summit would not be the World Health Summit if there would not be the Charité. The Charité is the 300-year-old, now 311 years old university medicine in Berlin. And it's the product of the fusion of East Berlin and West Berlin medical faculties of the Humboldt University, of the Free University. And the new CEO since 4 weeks about now, Heyo, is Professor Heyo Kroemer, and he is going to welcome you now.
Well, I guess it's a difficult reset after this emotional and excellent presentation. Ladies and gentlemen, dear colleagues, Detlev, it's my privilege and pleasure to give a really short note on the opening of the 2019 World Health Summit. Under the long-lasting leadership of Professor Detlev Ganten and his colleagues, this meeting has emerged as one of the most important venues in global health. The World Health Summit was founded on the occasion of the 300th anniversary of Charité, celebrated more than a decade ago. My country, the Federal Republic of Germany, had in the past not really an outstanding record in global health. This has changed in recent years for various reasons, among them strong political support. We've heard the minister. Germany has been working more closely for global health policy for the last years now, has made global health a strategic priority. As part of its G7, G20 presidencies, Germany has, among others, supported the strengthening of health systems, the fight against antimicrobial resistance, universal health coverage, and control of infectious diseases. Today, with about 1 billion euros annually, Germany is one of the largest donor countries in the field of global health. Moving from the country Germany to my institution, the Charité, it's noteworthy that we have established a global health center and are committed to supporting many global health initiatives in research, teaching, and healthcare. Being a rather large institution, 18,000 people working with us, caring for more than 150,000 patients in 3,000 beds, we are part of a larger academic network in Berlin. The Berlin University Alliance, to which Charité belongs together with the 3 major Berlin universities, the Free University, Humboldt, and the Technical University, has named global health as one of the major research topics and wants to use and promote the integrative effect and the potentially great social impact of the topic. Berlin in general has emerged as a hotspot around health system issues. In recent years, large international organizations have moved to Berlin, e.g. the Wellcome Trust, the Bill and Melinda Gates Foundation, Oxford University, and the London School of Hygiene and Tropical Medicine. From my point of view, Berlin offers unique opportunities in biomedicine. There's an excellent basic research in the field of life science, for example, the Max Delbrück Center for Molecular Medicine, several Max Planck Institutes, and the Berlin Institute of Health, which is co-founded by the Federal Republic and the state of Berlin, dealing with translational medicine. A very special feature is the fact that about 50% of the hospital capacity in terms of patient care are owned by the state of Berlin, giving rise to innovative opportunities in terms of both care and science. Consequently, the state here has developed a strategy for the Health City Berlin 2030, defining the cornerstones for cooperation and translation. Coming back to my initial topic, global health, I'm convinced that this is one and the important topic connecting medicine, the universities, the private sector, and NGOs. We should be able to develop a convincing narrative which is well understood and supported by the public. For the members of the board who are in the audience, I can state that we are delighted that Berlin in general and Charité in particular, closely intertwined with, since yesterday, 27 M8 Alliance members, have the honor to host the World Health Summit. I wish you all a successful and inspiring conference, and thank you for your attention. Thank you.
For those who don't know the city of Berlin, the Charité is right in the center. and the CEO looks from his window on the Charité on the Chancellery. And in between the Chancellery, there's the Ministry of Research and Technology. And the next speaker is one of the most experienced politicians in German politics, State Secretary Christian Luft. He has been working in the Chancellery for several years. Then he moved closer to the Charité. And we are very happy now to have you here, State Secretary, to give us your talk. Thank you very much, and the floor is yours.
Thank you very much, Professor Ganten, Professor Jafarian, esteemed organizers, Minister Spahn, distinguished fellow speakers, ladies and gentlemen. Andrea Wulf, you told us, be more emotional. So I'm not the emotional one, but I will try. The summit's aim is to tackle the global health challenge we face today. This is an important and worthwhile endeavor. I'm convinced that the way in which we deal with global health challenges today, determines the future of every single one of us, and in fact, the future of our entire planet. Please allow me to begin my speech with an entirely German matter. I do so for good reason, because when we talk about global cooperation and joint actions, we have to be aware of our roots. This year, we are celebrating the 70th anniversary of the German Constitution. And I take pride in emphasizing that the freedom of arts and science, research and teaching is also guaranteed in Article 5 as an essential and fundamental right. As a consequence, it is the urgent and noble duty of government to protect the freedom of research and to provide the necessary resources for this freedom to flourish. Fulfilling this duty is necessary for science and research to thrive, which will lead us knowledge gain, progress, and ultimately to solutions for the global challenge we face. Certainly, securing health and well-being worldwide is one of the most pressing challenges. Whether it be climate, global health, or the fight against poverty and hunger, only free science can provide us with the evidence we need to base our decisions on and to take action in the true spirit of multilateralism. However, it is not sufficient to merely protect the freedom of research and provide adequate resources. We also need more than this if we want to tackle the most burning issues in the world. We need additional resources and capacities. This brings me to another point I would like to emphasize. Germany believes it is important to accept responsibility for global health issues in the spirit of international cooperation and multilateralism. Accordingly, we have increased our support for research and development on global health significantly in recent years. I cannot stress enough that science, research, and development are indeed important drivers for health and well-being. These activities are defined by Global Action Plan for Healthy Life and Well-being for All as some of the key success factors for achieving this goal. Global health issues are complex problems in a complex, interconnected world. To improve global public health, we need international and collaborative approaches. We cannot solve these problems in national isolation. Bilateral and multilateral collaboration between different countries and different partners from different sectors of society is essentially for making progress. Working together boosts research and development and is crucial to solving complex problems. Therefore, the German Ministry of Education and Research is a key partner in several international alliances which bring together stakeholders from various sectors. My ministry has, for example, invested substantially in safety, and our aim here is to push vaccine development for emerging infectious disease like Ebola or MERS. CEPI contributes to global health security by helping us to respond rapidly and effectively to future infectious disease outbreaks. I think CEPI proves that global cooperation and coordinated efforts are key to rapidly providing solutions to the challenges we face. And still, we shouldn't forget another important point in all our efforts to improve global health, making sure that no one is left behind. Everyone must have access to these new solutions. This implies that those who are most effective must have a strong voice, both in the definition of health challenges and in the development and implementation of solutions. As research funders in the Global North, we must pay greater attention to the needs of those affected. We have to do better than we have done in the past. Fostering equal partnerships with academics and decision makers in the affected countries will help us challenge our own views, assumptions, and approaches. We might discover that the actual needs differ from what we have believed them to be. But ultimately, I'm certain that it will improve our efforts. And finally, I would like to mention a positive example that places the consideration of local requirements at the core of research collaborations. The BMBF-funded initiative, Research Networks for Health Innovations in Sub-Saharan Africa. This has been developed in collaboration with decision makers from African countries. The network clearly addresses local needs. This initiative not only improves public health in Sub-Saharan Africa, but tackles one of the major problems in global health research: the fragile and often missing research capacities in low-resource settings. The funding initiative supports African academics in leading international research consortia. It provides junior researchers with opportunities to develop research skills and places strong emphasis on the translation of research findings into policies and practical solutions. And I think we need more such initiatives. And I'm therefore grateful that one key topic of this year's World Health Summit is Focus Africa, building capacities and strong institutions. Ladies and gentlemen, I have provided only two examples that illustrate how Germany has increasingly accepted its responsibilities of global health. We are, and we will dedicate it to collaboration across national borders and political viewpoints. We are committed to ensuring that no one is left behind. And I welcome the fact that this World Health Summit provides an opportunity to celebrate the progress that we have made toward achieving health and well-being for all, as well as the opportunity to challenge one another about remaining gaps and to make plans for our future. And Andrea Wulf told us about Humboldt, and he himself told us everything is interaction. So I hope we will work together for a better world and for better mankind. Thank you very much.
Everything is interaction, and success of global health depends on interacting of all parts of policies. Health in all policies is the secret of success. And thank you very much with all your experience in various positions in the German government to promote health in all policies, not just in this country, but also globally, and really support the global interactions of Germany with all the other multilateral players. Thank you so much. Ladies and gentlemen, the next speaker comes from a completely different area, the private sector, but he's also a scientist. And he is coming from a company which was actually originated from the interaction of one of the best scientists in Berlin at that time, one of the most famous. There was Alexander von Humboldt, there was Rudolf Virchow, and there was Hermann von Helmholtz. There were a few others, but Hermann von Helmholtz was one of the great scientists. He was a medical doctor, and he was a physicist. And he got together with Werner von Siemens, and they founded the Siemens company, Siemens Halske, and then Siemens. And now it's Siemens Healthineers, the part of Siemens which is dedicated to global health. And the person representing Siemens Healthineers is Professor Bernd Montag. He is a physicist, a scientist, and CEO of Siemens Healthineers. Professor Montag.
So I need to be humble, no professor, just an ordinary doctor in theoretical physics, yeah. So, and too tall for that microphone, yeah. So I hope you can hear me, yeah. So sorry for this. So be serious, okay? So, Herr Luft, I chose the emotional topic, why I'm happy to be here, yeah. And I'm happy to be here because healthcare is a team sport. Why is it a team sport? Yeah, because healthcare is too challenging for one individual. Yeah, so that is why we choose to dedicate our life to a specialty. Yeah, so we are either in research, we are in medical practice, we are in policy making, we are in technology development, we are in global companies. And even in these respective fields, we subspecialize. Yeah, we become cardiologists, and then become whatever. Yeah, we become cardiac surgeons, or we become software developers, and so on and so on. And that is what requires team sports. Yeah, because we need to be deep, and on the other hand, we need to understand each other to solve the challenge as a whole. Yeah, and we should do this in a spirit where we don't believe that the specialty we chose is the one which is better. It's just a specialty. Yeah? And in a moment like this, I am happy to be here because I can meet all other people who have chosen different paths. Yeah? I personally had the big luck in my career, yeah, that I growing up in Siemens Healthineers, what is now Siemens Healthineers, that I can now lead an organization which is completely dedicated to making the healthcare system more efficient. Yeah? An organization of 50,000 passionate people, passionate about healthcare, who all have different backgrounds, yeah? From 20-year-olds to people close to retirement, from software engineering to superconducting specialists in MRI to physicians, to regulatory specialists who work around the globe, yeah, whether it is the US or China, whether it's the Ukraine or Russia, yeah, or Israel or Saudi Arabia as one team, which I find exciting that this works, not with one exception, every 4 years when we have the Soccer World Cup. It's a bit of a problem, yeah. But it shows, I think it is exciting that this is possible, yeah. But and I want to share from this perspective, yeah, why the World Health Summit matters for us. And I give you 3 reasons and a bonus reason. So, number 1, what I think is exciting and interesting, and maybe something we are not always conscious of. Med tech and medical science is global, healthcare is local. Yeah? So we all share the same technology and the same scientific knowledge, but the deployment is a very local, country-specific topic. Yeah? We have private healthcare systems, like India, we have very public ones, state-driven, like in China, we have the NHS, we have the German mixed systems, we have the big consolidators in the United States. Everybody does it in a different way, and I think this is something which is unique and which also shows that healthcare is a team sport, because we can learn a lot how to best do it. And for me, an opportunity like the World Health Summit is an opportunity to exactly have the exchange on this. The second topic, which I find is also a topic we should be all aware of, is how do we define impact? I have been at the meeting of the American Hospital Association 3 days ago, and there was a big discussion. It was interesting. There was a panel. It was moderated, what is the future of health? And there was a person talking about quantum computing and immunotherapy and so on, and then let's have a discussion. Yeah? And then people said, running the big hospital chains, well, this is all interesting, but my problem is that the life expectancy in one neighborhood of, let's say, Boston, is 12 years shorter than in another neighborhood. Yeah? So we have a problem called the social determinants of health, or they also call it the social determinants of dignity, which shows a deep translation problem also. How do we define impact? Impact on the one hand in the sense of we have scientific impact, impact points and so on and so on. We as Siemens Healthineers can take pride of some new technology and so on, but I think we should be humbled also by what really makes impact. And what really makes impact is how do we reach the people in emerging countries, how do we reach people in underprivileged areas of developed countries. And this, again, is a team sport, and this, I believe, is, again, one of the great reasons to have this summit, because here all stakeholders come together. The third big topic is digitalization. Not because it's the buzzword of the last years, because it is gold in our hands, because digitalization is an innovation or a big theme which can solve many of the challenges we inherently have. It is not a high-cost innovation. This is innovation with which we can reach affordability and accessibility very, very quickly. There are more mobile phones, or the penetration of mobile phones is higher than the penetration with spectacles in India. We can see how these technologies spread and how it helps to solve also many of the infrastructure problems of do we have enough trained specialists and so on and so on. And solving this together, using this huge potential is, I think, a big topic in itself, by solving also the special challenges healthcare has in terms of privacy, really security, and also respecting the existing medical specialties. And again, I believe this is a topic where healthcare is a team sport and requires all stakeholders as they come together here to work in one team. And now I come to the bonus topic. The bonus topic is, I believe we are all privileged that we can work in such an important topic which unites people worldwide. 7 billion people want to be healthy. We say in German, Gesundheit ist nicht alles, aber ohne Gesundheit ist alles nichts. Health is not everything, but without health, everything is nothing. So this is a common theme. And if we demonstrate how we can work together as a global community with different views and different specialties, I think we can also be a beacon for other challenges in the globe. And not because we believe that we are better people, but because I believe we have the responsibility to give back for the privilege we have to be allowed to be active in this field. I hope that was not too much. That was the bonus topic. Yeah. Thank you very much. This is why I'm happy to be here.
Thank you, Dr. Montag. I think he made it clear for all of us that how technology and science could do their part and in health promotion and health improvement worldwide. And now we, as healthcare advocate or healthcare professionals, have to deal with this part, which is industry and private sector. Thank you very much for your very informative remark. Now I'm honored to introduce the next speaker in this opening ceremony of 11th World Health Summit meeting. I'm going to introduce Her Excellency Dr. Magda Robalo, Minister of Public Health of Guinea-Bissau, country with a perfectly gender-balanced cabinet of ministers. Dr. Robalo adopted a vision of more and better health for her tenure, marked by a strong drive toward universal health coverage. She has an interesting blend of experience from academia and government to UNICEF and WHO. And her gender equality activism is transcontinental. She is a founding member of the Lusophone Initiative of the Women in Global Health, Portuguese chapter. Ladies and gentlemen, please welcome on the stage Dr. Magda Robalo.
Thank you for that introduction. Honorable Ministers, Secretary of State, Professor Detlev Ganten, fellow speakers, distinguished invited guests, ladies and gentlemen. It is an honor for me to be here tonight, and it's a great pleasure to share with you some global and local health and development perspectives at this opening ceremony of the 11th World Health Summit. And I would like to thank the organizers for inviting me to be here tonight. Because of this invitation to be here today, there is one thing I'm very sure about. Right now, some of you are busy Googling to locate Guinea-Bissau on the world map. I come from that tiny, beautiful country in West Africa, and I bring the voice of the Portuguese-speaking community, which is hardly heard in forums such as this one. Guinea-Bissau's ranking on the global health landscape is far from being the best, but we have a world of opportunities in front of us, and we are grabbing them with both hands, with a strategic mind and with a sharp eye. The World Health Summit provides us a platform to interrogate our collective approaches to improve global health and well-being, incubate new ideas and innovations to deliver on our promises of leaving no one behind. In just about 2 months, it will be 2020, and we will have only 10 years to prove that indeed we can change the fate of billions of people around the world, the global South and Africa in particular. We need a new level of ambition from here to 2030. Ambition is a renewable resource. As a Minister of Public Health, let me share with you an economic perspective I gathered from the just issued International Monetary Fund's Regional Economic Outlook for Sub-Saharan Africa, which is titled Navigating Uncertainty. The IMF predicts that economic growth in Sub-Saharan Africa will remain at 3.2% in 2019 and rise to 3.6% in 2020. It further anticipates that economic growth will be slower than expected in 2/3 of the countries in the region due to the threat of rising protectionism, tighter global financial conditions, faster than anticipated slowdown in China and in the Eurozone, climate shocks and intensification of security challenges, among others. These are some of the issues we should be tackling in our conversations. As experience tells us, progress on social outcomes, especially on health and well-being, depends very much on the growth path of the economy, locally and globally. We need to harness our collective creativity, change gears, and as needed, where and as needed, to fight back the challenges that the economic outlook will impose on us, ministers of health and partners alike. We should navigate these uncertainties with a new level of ambition and determination. Smart economics, purposefully working for universal health coverage, is what we need. The Global Action Plan for Healthy Lives and Well-being for All is a powerful instrument to assist us in doing so. We need to work hard with the Ministers of Finance to review fiscal policies and other instruments and frameworks and undertake structural reforms that allow domestic sustainable financing of quality health care and put us on the path of achieving universal health coverage and the Sustainable Development Goals. The Sustainable Development Goals obligate us to deliver for the poorest people in our communities, people that continue to be trapped in endless cycles of poverty and preventable diseases, especially if you are born in identified geographic zones of this planet. Thinking of those left behind and zooming into neglected tropical diseases, we have a real opportunity to change the course of lives of over 1 billion people affected by this group of diseases. The tools to deliver are here. Countries are succeeding in eliminating these diseases one by one after the other, including my own Guinea-Bissau, where we are reaching our last mile for eliminating trachoma by 2020, and a couple of other NTDs within the next few years. I encourage other countries to consider the elimination of NTDs as a tracer for equity towards universal health coverage and to support the implementation of the new roadmap on NTDs, which will be launched in 2020. Ladies and gentlemen, distinguished invited guests, the Gini coefficient and the Gender Inequality Index in Sub-Saharan Africa remain among the highest in the world. We live in worlds apart from each other, within borders and globally. The IMF tells us that the cost of health services in Sub-Saharan Africa is significantly higher than in other parts of the world, along with the prices of food and clothing as a consequence of market structures and competitiveness. Clearly, microeconomic outcomes shape social outcomes and vice versa. We know that we need to transcend the health sector in order to have an impact. We know that we need stronger connections and dialogue with the Ministers of Economy and Finance and relevant partners. There will be no inclusiveness. We will leave billions behind if we don't build the necessary bridges to reach 2030. As it was mentioned by during my introduction, I'm a proud member of a perfectly gender-balanced government. I'm one of the 8 female ministers of a 16 members ministerial cabinet. Guinea-Bissau is one of the only 14 countries in the world today with a gender-balanced government. I'm proud of this achievement by my country. It has not been easy to reach this point, and we know progress is fragile. I'm also acutely aware of the fact that this gender-balanced cabinet does not reflect the position of women in our society, but this is a means to an end. Through us, hundreds of thousands of women in Guinea-Bissau hope to be lifted up and empowered because of the policies we will adopt, because of the role model significance of our stand, and because of the efforts we'll make to empower them, particularly the young ones, to claim their right place in our nation and around the world. Globally and locally, we need to continue to disrupt the norms, challenge the status quo, and institute a new normal. This requires a new level of ambition. It also requires that we embrace diversity, that we break language barriers, and consider the intersectionality that underpins the understanding of gender equality. Health is a political choice, as Dr. Tedros constantly reminds us. But health is also a political currency. The healthier the people, the healthier and stronger the economy, the healthier and powerful is the country. Stronger economies have healthier, longer living people, and I'm not telling you anything new. Since becoming a politician, I've learned that political value of a strong or weak currency that health is or could become. Sure, health is not tradable, but enables trade to prosper. Our ultimate goal is to equitably share prosperity. To conclude, allow me to encourage us all to embrace the choice we have made in September at the United Nations General Assembly with the adoption of the political declaration on universal health coverage. The same water never passes again under the same bridge. We have a unique opportunity to change the face of the world. I thank you.
Thank you so much, Minister Robalo. Your presentation made clear that indeed going to different cultures and learning about different cultures is so important if we want to improve global health. Health in part is a question of the culture we are living in. And you may be interested that the World Trade Summit is quite balanced. We have about 50% participation of male and female, and close to 50% speakers, male and female, which is not usual in this type of conference. It also shows that cultures are different, and if I mentioned a title to a person who rejected this title, may I say that in Germany you think you do something very good to a person if you give him the title. And usually you don't reject it if it's a title which you did not deserve. So I'm just saying that because I'm offering to all of you, just call me Detlev in the future. Forget about any title. The next speaker is from a French-German company, Sanofi Pasteur, which actually, if I may say so, incorporated a major German company. So it's a real French-German company, and it is important to know that the patrons of the World Trade Summit, first of all, was Chancellor Merkel, and then immediately the President of the French Republic said, I want to be a co-patron. So showing this close synergy between France and Germany was very important. It was not a national patronage, it was an international European patronage with the President of the European Union joining in, and now with Dr. Tedros, the Director General of WHO, it has become real international. But the core was French-German. And this may sound not so important for many of you, but if you look at European history, you know, and I'm old enough to realize that there were times in Europe where France and Germany were not always the best friends. Now we are not just living together and helping to organize and revive and vitalize Europe, but we are real friends. It's friendship between these countries, and it's wonderful to know. And it's great to have the Chief Executive Vice President of Sanofi Pasteur, David Loew, here to speak to us as an important person in the French-German company, but also representing this co-patronage of France and Germany. And I'm sure you have much to say about health. You are a specialist in vaccination, and of course, vaccination is a very important methodology, kind of treatment for the future of health of major populations. Thank you very much for coming.
Ladies and gentlemen, it's a great honor to open this World Health Summit together here with you. And I would like to thank Detlev for organizing this important summit, and also Chancellor Merkel, President Macron, also President Juncker and Dr. Ted Ross for the high patronage of this important event. We have seen fantastic progress in science and in medicine over the many past decades. But the access to healthcare and the access to the benefits of this progress have not been equally distributed around the world. And it's heartbreaking to say that it depends where you're born. That's the factor which is going to determine how your health is going to look like. So that's an area where I think as an industry we want to make a contribution on changing that. And we have, for example, joined the efforts of Gavi, the Global Alliance for Vaccine and Immunization in the year 2000, to really allow the vaccination of all the children around the world. And it has been a great privilege to contribute there. And I'm very happy to say that we have seen a real positive impact in the survival of children in these countries. As an industry, we have also established Access Accelerated in 2017, where we are working to make treatments and preventions available for non-communicable diseases in least developed countries. We have just last Friday announced by the International Federation of Manufacturers and Associations the establishment of Global Health Progress, which is our new interactive knowledge hub, where we are demonstrating the collaboration on over 200 projects of the pharmaceutical industry together with different stakeholders in the environment on 850 cross-sector partners. And that really has a positive impact, we hope, on the Sustainable Development Goals. Now, I believe collaboration is not just important to improve access to medicines. It's also important to really leverage the power digital can bring to healthcare. And digital can really change the way we look at healthcare systems. We take out inefficiencies from the healthcare systems. We can really accelerate the development of new data and better insights through research on data that are electronically available. And we can also accelerate the development of new drugs or new vaccines and develop them at a much lower cost. So obviously, this needs to be done based on anonymized patient records. But today, the technology really allows to do that. And I think legislation is in place to protect the patient data. But if we anonymize that data and we make it available to the research community, we can really leverage great progress. And I would just like to give two examples. The one is a database we have established, which is called Darwin. That database is consolidating data records of over 300 million patients around the world. And it's allowing us to conduct research in a retrospective fashion to analyze what is happening on those patient records. And these patient records were collected based on real-world effectiveness data as well as on clinically prospective randomized trials. Now, we have done, for example, research on influenza and looked at what are the negative impacts that diabetic patients or chronic disease patients can face when they have an exacerbation of their diseases based on a flu that they're going through. And we have seen that it can impact their diabetes, it can cause heart attacks if they're not correctly vaccinated. So it allows us really to generate a lot of new insights. Now today, I would like to announce a completely different way than collecting data just retrospectively and analyze them. We are conducting at the moment 2 trials that we have put on clinicaltrial.gov, one with Kaiser Permanente, where we are comparing in a prospective fashion over 2 seasons how 2 different vaccines against the flu are working, and where we are going to include 1.6 million people in that trial. We're also going to conduct a trial with the Nordic group that we have put 4 days ago on clinicaltrial.gov, where we are comparing 2 different flu vaccines over 2 seasons, including 68,000 people alone in Finland. So that's a totally new dogma. So we're including patients now prospectively based on electronic data records, and that's going to generate a humongous amount of new data where we're going to gain insight on a prospective fashion. Now you can imagine, ladies and gentlemen, that the current way of the pharmaceutical industry to conduct trials doesn't allow to include these numbers of patients on a database. So it's really only through the transformative power of electronic health records that we're able to suddenly randomize and prospectively collect so many people on a database, which is going to increase massively the number of insights we're going to generate. Now, to achieve this and to expand this to other diseases, we need to all work together to harmonize the electronic health records and to agree on what kind of data fields in different diseases we are going to capture. My dream is that we can do this new way of collecting data not just in one state like California or in one nation like Finland, but that we can do it across multiple nations and across multiple diseases. It's not an easy path. It's going to go through a path of letting go in terms of what is the data that we all want to collect in the different countries and in the different institutions. Sometimes we are having difficulties to even agree inside of an institution or a hospital on what kind of data we want to collect. Sometimes we're having difficulties inside of a nation to agree on what is it that we want to collect and which software we want to be using. So it's not going to be an easy process, but I think I have a lot of courage that this is possible, that we can get there. We have seen big changes very recently, for example, in Germany, where we have just seen the digital supply law being passed, fostering harmonization inside of Germany, and that's really encouraging me a lot. We have also seen the French system adapting. We have seen a lot of strides made, for example, in the United Kingdom or in Israel, or the Minister of Health of the Netherlands has just passed a law where digital health records are now being mandated in that country. So the next step now is to harmonize these databases and to agree on the data we want to collect. This is going to really unlock the potential of patient records. We are sitting today on a mountain of data, but it's still in form of paper. And so it cannot be accessed in an easy way. And that's really a pity, because if we can unlock the power of digital data, we can really organize our healthcare system much better, make it more efficient, generate economies of scale, increase the speed of research and scientific insight, and we can unlock the power of collecting data on new drugs or on new vaccines much more quickly. And that, in the end, to the benefit of people and patients around the world. So it's an honor to be here with you tonight on this exciting summit. I call on all of us to work together to make these challenges go away and really work together to accelerate the research that we are all conducting together for the benefit of patients. Thank you very much.
Thank you, David. Everything is interaction, and I think your talk has shown that indeed classical pharmaceutical industry, from the laboratory to the bedside and then trying to develop some drugs, that's still going on, but that's in a way the past. Technologies have to go from science to pharmaceutical industry, but then you need other technologies developed elsewhere, and you need politics. So it's an interaction of various parts which need to collaborate to really bring about new drugs for worldwide application in new situations. Now, ladies and gentlemen, we are coming to an end of a long, diverse, biodiversity is the name of the game, diverse opening session, and this is another highlight. And the next speaker is Tolullah Oni. Good friend, Tolu, where are you? Somewhere in the audience. Oh, there you are. I thought you were with the young people. Because Tolu is young. She was a member of the, actually co-chair of the Global Young Academy, which is a group of young people of all academies of sciences, humanities, and medicine around the world. And she has been very efficient in getting this very active worldwide. She is a physician scientist, has studied in Cape Town and Cambridge, in London and many other places, is very interested in urbanization, and we are very much looking forward to what you have to tell us now. Tolu, your floor is yours.
Thank you, Detlev, for the generous introduction. So in the age-old tradition of the human race, I will anchor my talk on a tale. And adopting the Nigerian folklore tradition of storytelling, I will request some call and response participation from you. Because I need a signal that I have your attention, and I need your permission to recount this tale. Okay, so this is the tradition. When I say story, story, you say? And when I say once upon a time, you say? Okay, so once we write that, then we'll be ready to begin. Story, story. Once upon a time. I'm going even further back in time than the historian, which is a little unsettling, to start this story in medieval Northern Europe with a Viking called Eric the Red. Stay with me. Eric was exiled from Iceland for 3 years and sailed west to spend this time exploring the land now known as Greenland. On his return from Iceland, in his return to Iceland, he convinced others to return with him to resettle in this new land. And so in 985, a few hundred people set sail for Greenland and set up 2 Norse settlements in the east and west. The societal structure was one of subsistence farming and harvesting of wild resources. For these immigrants, survival and prosperity required a strong sense of social cohesion, juggling both pastoral farming and hunting of wild species, such as walrus for the ivory and tusks, informed by traditional ecological knowledge, whilst maintaining trade with Europe to maintain their political, religious, and cultural ties that were so core to the sense of identity. The settlement thrived and grew to a few thousand people at its biggest, surviving many hard years, drawing on this traditional knowledge and cultural practices, not only to persevere, but to prosper. But in the late 13th to mid-14th centuries, several co-occurring processes operating at varying temporal and spatial scales unfolded, some of which may have been apparent to these North settlers, and some which were distant and apparently disconnected. And by the 15th century, these settlements had been abandoned after being in existence for 500 years. So why did they reach the limits of their adaptive effectiveness? Climate volatility and the Little Ice Age were previously thought to be the key factor responsible for this. But scholars have unveiled evidence that put forward alternative, or rather additional, theories that may have contributed to the demise. The first was sea level rise and food insecurity. So sea level rise operating over centuries destroyed significant areas of lowland pasture, and the diets had to adapt with increasing seal meat consumption and hunting organized as communal harp seal hunts. The second was climate change and human settlement vulnerability. So these changing environmental conditions and farm vulnerability required a reorganization of the settlements from being widely dispersed around the inner and outer fjords to more concentrated settlements on the inner fjords. Whilst these adaptations reduced the farm isolation and that vulnerability, it also distanced them from their food source that they had to adapt to, where the seals were. And this compounded food shortage. There is some evidence of a hostility between the Norse and the Tolullah Inuits. The nomadic Inuits had developed sophisticated hunting technology to hunt ringed seals that were actually much more difficult to catch, as they stayed deep underwater for a lot longer. And this technology was very different to what the Norse had for their communal hunting. But the Inuit cultures were considered too heathen and too distant from their core values of medieval Christianity to be considered for cooperation and intercultural exchange of technology and skills. As a result, despite the growing role of seal meat in their diet, they didn't have the technology to hunt the seals that swam all around them. Their failure to learn from Inuit technology, driven by the same social values that mobilized their community for successful adaptation in the short term, stressed these traditional sources and reduced their resilience in the context of unprecedented change. What else was happening? The bubonic plague, thought to have resulted in the death of up to 60% of the European population. You'll remember that the economy of these settlements were driven largely by prestige luxury values, items such as ivory. But as a result of this devastating impact on population health, there was a decline in demand for luxury items. And with the economy entirely geared towards this prestigious commodity, it would have destabilized the economy. Are you still with me? Also happening at the same time, power and trade shifted away from Scandinavian societies, with export interest focused more on the Baltic, North Seas, and the opening of trade routes to Russia, increasing access to other sources of these luxury goods. Also, new urban markets were less interested in these luxury items and shifted towards large quantities of the high bulk and low value items such as stockfish, shown here. But without access to dried fish or wool for export, the economy would have dwindled, further contributing to their isolation. And so, from Norse to now. globalization, international trade and commercial activities, and the dynamics of shifting power and its impact on societal well-being. Changing human settlements and migration influenced by changing climate and food insecurity. Cross-boundary impacts of disease on population health and its socioeconomic determinants. Leadership and its role in promoting or limiting intercultural dialogue. The potential for science and technology to bridge cultures and societies for collective resilience. Any of these themes familiar? As a public health physician scientist whose research is focused on intersectoral co-created interventions for urban health and equity, and the investment case for disease prevention and population health creation, these are matters core to the work of my research group. And the Norse experience demonstrates the interrelated and interdependent ways that these themes, then and now, can negatively impact society. But I think they also represent potential acupuncture points for action. So I can't help but wonder, what if they understood public health security, cross-border disease and health determinant trends, and the importance of preparedness and the impact of health beyond their borders on their development and on peace? What if they unleashed science diplomacy to foster intercultural dialogue and learning collaborations and technology exchange to adapt existing knowledge in ways that make society more resilient? What if they had leadership that recognized complexity and invested in breaking down silos and conflict resolution, particularly in the face of unprecedented change? What if they had a society that simultaneously understood the value of traditional knowledge and the importance of embracing cultural non-conformity to supplement traditional knowledge for long-term resilience? What if they took a more far-sighted approach to understand the interdependencies between changing climate, shifting political power, globalization and trade, migration and mobility, population health, and the potential impacts of these events and processes on human settlements and society's ability to adapt and thrive in the long term? What these events had in common was a non-sense of going it alone and focusing solely on self-interest, and the necessity to reach out beyond the usual boundaries of knowledge, beyond the historical barriers of conflicting societies, beyond the geographically bound ascribed leadership in order to survive and thrive. This tale from the past offers insights for the long-standing dynamic into the balance between society and the planet. And I think provides lessons for now as we face challenges of rapid urbanization, climate change, degradation of ecosystems that impact infectious and non-communicable disease risk and trends, driven by forces beyond the borders and powers of a single city, nation, or region. Addressing these unprecedented threats to population well-being will require a recognition of the strengths that have fostered resilience to date, while simultaneously acknowledging the limitations of our current knowledge. And when our past, experienced through the lens of our core ideologies and self-beliefs and belief systems, are alone an inappropriate guide to our interdependent futures. New leadership is key. And it's no coincidence that the word young appears twice on this slide. As a proud alumna of the IAP Young Physician Leadership Program and a member of the Global Young Academy, I know that action is being taken to nurture the next generation of innovative, transformative leaders for this monumental task. And I hope that over the next couple of days and beyond, we remember and embrace these historical lessons and adopt a spirit of humility, recognizing the limits of our knowledge, however well this may have served us in the past, and embrace diverse knowledge sources and different ways of knowing, because the complex human and planetary health challenges faced will require unprecedented and sometimes uncomfortable collective action by all sectors of society. And so, in that vein, I wish you a fruitful and highly uncomfortable meeting, filled with constructive, weird and wonderful discussions, in the expectation that we emerge through the discomfort, learning from unusual sources to foster the close collaboration and cooperation required to find ways to address wicked problems facing people and planet towards a sustainable future together. And because I know of no folkloric tradition to signal the end of a story, I end conventionally by thanking you for your attention.
Thank you, Tolullah. Merci beaucoup. We need more young people like you to invigorate global health. Global health will not provide us with fast solutions. It needs long-term thinking, endurance, patience, and thank you for your patience to sit through this opening, which I hope was interesting for you. And now we are coming to an end. And perhaps one idea might be that we listen to the girls' choir of the Sing Academy and hear another verse of the Humboldt Welcome Cantate. And by closing your eyes, you have all the talks pass again before your eyes and think about what you heard, what you learned, what you would like to follow up in the next couple of days, whom you would like to meet, and how you would go on, helping us together fulfill the dream of improving health worldwide. That is the purpose of the World Health Summit. So please welcome with me to end the welcome ceremony of the World Health Summit, the Sing Academy under the leadership of Friederike Stamer.